it is very important for caregivers to understand what are the serious complaints and what are the minor complaints. So what happens with elderly? Usually they will be having some of the complaints chronically. Okay, acidity is one kind of, like, they repeatedly have. But many a times what happens, this acidity may not be simple acidity and it can be a heart attack. Okay. So whenever you see the complaint, whenever an elderly says about some complaint which is slightly different from the routine chronic complaints, it needs to be medically evaluated. So what we have seen is many a times we feel, suppose it's like someone, father is chronically having some kind of pain. Father again tells him, no, today I'm not feeling well, and things may get ignored. It may not be intentional, unintentionally. Then it is chronically going on. This can be a problem, especially with diabetic patients. So diabetic patient, as it is, they don't have pain. So they can, like, they may present with some vague complaint, tiredness. Tiredness should be looked on by the caretakers very seriously. So a person who was very well till yesterday and suddenly today morning he starts saying he's feeling too tired, and it needs to be evaluated. Okay. So this is heart related. Breathlessness should be taken very serious. Any patient, we have seen one more common thing is ghabrahat. So if suppose any of parents says, hey, I'm getting ghabrat like feeling, then it has to be a significant thing. You cannot just ignore that, because that symptom he only understands that feeling. Stroke, the problem with stroke is, as we know, paralytic attack, there are two types of stroke. Either it is a hemorrhagic, which we call brain hemorrhage, and second is ischemic, in which the blood vessel which is supplying brain, it gets choked up. The problem with this choked up ischemic stroke is there's a treatment window of only 4.5 hours in which a clotbuster injection can be given. Many a times what happens at home, patient suppose develops this, and initially patient may recover out of that. So left hand weakness was there, which has recovered over some time, and again he develops. So what family members think, okay, this may occur, it might be with age something is going wrong, but it is not like that. It can be a major stroke, and then he can land up in full-fledged paralysis. So all these weaknesses, tirednesses, all this should be seen with very serious components.